it is important that we as women understand our pelvic floor region. What do we see if we bring a mirror and look at this area? Now, this can be very intimidating for some women, and for some women, this is the first time you've done it. But the importance is that you know what's normal for you, because every woman is different. Also, again, that we understand if there's a discomfort or a change, we can communicate that with that. And again, all of this is understanding your body so that when you go in to have your baby and you go through labor and delivery, you're able to understand what the nurses and the doctors are talking to you and express your questions and concerns as well. So what I would recommend is getting a mirror, putting one foot up on a toilet so you can see this area, or sitting on your bed, putting your back up against the headboard. I know it's uncomfortable and a little awkward, especially as you're pregnant if you're in your second and third trimesters. We're just looking on the outside. So let me walk you through this whole area. On the front, on the pubic symphysis, on the outside, it's called the Mons pubis. And this is the area where it's a little bit of a fatty tissue and the hair is growing. So that's what you're going to see first. Then you're going to walk down and you can open up the skin folds. The outer skin that has hair, also known as the outer lips, is the labia majora. Now, when you open that area and you start looking, this is actually called the vulva. Many times we call it the vagina, but actually the vagina is internal. What you can see on the outside is actually the vulva, and we'll call the vulva from the pubic symphysis all the way back to the anus. So that's a general term. So this is the vulvar area. So we came down from the Mons pubis down to the labia majora. We open those up. Then you will see some lips, the inner lips. Those do not have hair. And during pregnancy, sometimes those actually get larger and are bigger than the labia majora. So you may see notice some differences, and that's identifying where you are. When you open up the labia majora, the labia minora, then you go in, and this first area that you see is the clitoris, and that is for sexual function and enjoyment. As you come down, the next opening is the urethra. That is where the urine comes out. Moving down farther, you'll see the vaginal opening, and this is where you insert a tampon. This is where, with sexual intercourse, the penis is inserted. This is where you have a pap smear. And this is the area, if you go inside, is the vaginal canal. And then above that is the cervix and the uterus, where the baby is growing and sitting for 9 months. Now you continue to go down here, and this is the anus, or the rectal opening here, where it opens up so that you can have a bowel movement or relaxes a little bit. This area is really important too. This is the perineal body. Now, we need flexibility here so that you can have a bowel movement, so that you can sit, so you don't have any discomfort. After you have a vaginal delivery, sometimes there can be a tear. Now, there's grade 1, 2, 3, and 4 tears, and what happens is then you may have a little bit of scar tissue there, and we want to keep this area mobile. This is also the area with the perineal massage at week 34, 35. You talk with your doctor, talk with your pelvic floor physical therapist, and you can start doing some perineal massage. What that's doing is stretching this area and preparing it for delivery. So this is a little bit more about your pelvic floor or pelvic region. Again, using a mirror is very helpful. If that seems too traumatizing, you might want to talk with a counselor or a therapist as well, because some of these things that we talk about can trigger other things, especially if there's been sexual abuse in the past, or there could be other things that are causing just emotions and feelings, and that's okay. You want to get some help. Please don't be embarrassed about this. Women that are educated are strong women. So this is why we're going over all this information, so that you know your body.